Hi guys, my name is Olivia Deegan. I am a part of the F&P program here in UC, and I attended the State Medical Board of Ohio monthly board meeting on October 8th, 2025, 10 a.m. in Columbus, Ohio. So the purpose of that board is to protect and enhance the health and safety of the public through effective medical regulation. They have a couple goals listed on their website too, which are define and advocate the standards of safe medical practice. And the second is to ensure persons practicing medicine meet sufficient standards of education, training, and competence and ethics. So a lot of things were discussed in this meeting, kind of going in chronological order. They discussed suspensions and revocation of licenses. They took away licenses for a physician for malpractice, another one for sexual misconduct, and another one for endangering a patient by leaving them underneath anesthesia for too long. All of those licenses were motioned to be revoked. They also discussed CME requirements, specifically the Ohio Revised Code 4761, which discusses respiratory therapy and how long they have to keep their CMEs. As it stands right now, it's a year. They were motioning to have them keep their CMEs for 2 years because it's more difficult to audit when you only keep them for 1 year. They also had a motion approved to increase licensure application fees, and they were also discussing amended and new rules for Chapter 4731-25, which discusses office-based surgery. To keep that short, they were discussing that they have to keep they have to complete at least 12-hour course on the surgery. They have to observe 20 surgeries, and they have to perform 30 surgeries underneath a supervised physician. They also discussed having to have arranged emergency medical service and medical emergency transport, and also having to report adverse events within 30 days. So this, the healthcare policy issue that I wanted to talk about was disciplinary actions amongst medical professionals and having license suspensions serve to protect patients and uphold professional standards. So according to Jacqueline Landis in her 2019 article entitled State Medical Boards, Licensure and Discipline in the United States, the state medical boards have a variety of actions available to them, ranging between revocation or suspension of a medical license to probation to restriction of practice, reprimand, advisory letters, fines, and mandatory education/treatment of the physician. So license suspension can protect a patient by removing a provider who is unsafe, unethical, or who partakes in impaired practice. Some core principles of the medical system include autonomy, beneficence, non-maleficence, and justice, and having disciplinary action can help reinforce these principles. Also, being transparent about the disciplinary process and being public with that ensures the public that our profession self-regulates and prioritizes the patient's well-being. This affects us as nurses because knowing that our licenses can be revoked or suspended, or that we can be fined, holds us to a higher standard, and it makes us more self-aware, especially when we are in the moment having to stand up to doctors and to patients when we're being asked to do something that we might not be comfortable with. You have to say, no, I have to protect my license. The biggest thing that we can do is to document, stay within our scope of practice, and also report errors. For future advocacy, this aligns with nursing because nursing is grounded within patient safety and ethical practice and accountability, and also professional integrity. So having this disciplinary action to keep our nurses and healthcare accountable will provide the most competent practitioners, and also promotes a safe environment for our patients. And so I think that we can advocate for that. The one thing that I think we should advocate for is for rehabilitation and support programs for those who have had their licenses suspended. We can push for mentorship and counseling, and also retraining when appropriate. So good things that happened in this meeting. I was able to sit next to someone who was very interested in educating me on the meeting process, and she asked if I had any questions. It was very helpful. The one thing that I would suggest is understanding the flow of the meeting. I wasn't aware that I wasn't allowed to be in the meeting for a certain part, and I was kicked out by someone who was rude in a sense. So I wish I would have known that. And if I could give advice to anyone in the future, it would be to research these meetings in advance because it's really hard to find a time in your schedule. So be prepared.